Overall, session 3 captured the notion that the AIDS epidemic is not over, and that while some countries have achieved 90-90-90 goals, especially in Eastern and South Africa, there are even more countries that have still yet to fall short of those goals. And so there's still much work to be done. But I want to specifically recap what faith groups can learn from the science, research, and information presented at AIDS 2020, so that faith communities might have some key findings of the status of scientific updates and social dynamics within the HIV and AIDS epidemic. Professor Stanley Okolo, the director, presented this slide, and I think it's a good overview of what was covered during session 3 yesterday. General Okolo reminds us that we need to strengthen national and regional coordination and leadership to generate and disseminate strategic information and normative guidance, so that we might scale up targeted and comprehensive interventions that empower all key populations and ensure the human rights of key populations are respected. As a reminder, in 2019, there were 690,000 AIDS-related deaths. Progress toward 90-90-90 looks more like 81, 82, and 88, and so there's yet and still much work to be done. There was a coverage of treatment among pregnant women at 85%. Other key populations that were discussed in yesterday's session were sex workers, people who inject drugs, gay men and other men who have sex with men, transgender people, and clients of sex workers and their partners. To summarize the points made around key populations, there is a continued increase of proportion of new infections among key populations, and there continue to be structural barriers to accessing services. Inequality was a key theme throughout session 3, and inequality continues to drive the HIV and AIDS epidemic in key populations. Particularly, the main messages regarding women was, despite high ART coverage among pregnant women in some regions, child new infections continue due to a lack of retention and care in women acquiring HIV during pregnancy and breastfeeding. Again, HIV epidemic has been fueled by inequalities, and although there have been some great successes in the HIV response, progress is uneven, and COVID-19 has further impacted that progress. And so it's incumbent upon communities, and particularly faith communities, to be resilient and to be innovative as we think about the epidemic and ending it as a public health crisis by 2030. HIV self-testing was a key highlight of session 3 and AIDS 2020, considering that we are currently in the midst of dual pandemics, both HIV and AIDS and COVID-19. So HIV self-testing has become a rather innovative way to ensure that even in the midst of this pandemic, where people are unable to access services, they can still know their HIV status. Likewise, there were 2 new HIV drugs in the pipeline, lenacapavir, which is in and of itself a novel first-in-class caspase inhibitor, and islatravir, which is also a novel first-in-class nucleoside reverse transcriptase translocator inhibitor. Islatravir has particular significance for possibly being a long-acting antiretroviral, as well as perhaps a once-a-week version of PrEP. As you can imagine, many of the sessions were focused around the impact of COVID-19 and people living with HIV. Likewise, there's analysis of co-infections as it relates to not only HIV and COVID-19, but HIV, tuberculosis, and COVID-19, as tuberculosis is the major cause of death for people living with HIV. The conclusions that were drawn were that 2 people suffering from both HIV and TB are 2 times at risk of COVID-19 death versus those who do not suffer from those co-infections. Finally, there was a significant plenary during AIDS 2020 around the 2025 AIDS targets and setting the next generation of goals for the global AIDS response that talked about reaching targets for the next 10 years, but also funding the response to the epidemic. And this conversation particularly highlighted social enablers of the epidemic and noted that reducing stigma and discrimination, providing access to an improved legal environment and social justice, and allowing for gender equality are all solutions to ending the HIV and AIDS epidemic as it stands in 2020. Ambassador Birx reminds us that progress is not equal everywhere. We see this laid bare with COVID-19, and that community voices must really be forefront in any messaging we have. This is what UN AIDS strategy will bring to us, And it's that combination of data with communities and understanding the needs of the community, hearing the voices of the community, and most importantly, investing in the communities and the voices. And when I hear these comments from Ambassador Burks, I hear her speaking to the faith community specifically. The faith community is particularly in an advantageous position to respond to the HIV and AIDS epidemic in these ways. Granted these statistics, granted the level in which HIV services are provided by faith-based institutions around the world, granted that faith institutions are particularly poised to eliminate stigmatization, which has been identified as one of the key fuelers of the HIV and AIDS epidemic. And so once again, knowing these things, it's incumbent upon interfaith communities to commit to increase access to treatment, to promote human rights of all, to eliminate stigma and discrimination, and to build bridges of collaboration not only across other faiths, but across other sectors. I'll leave you with these words from UNAIDS Deputy Executive Director Program, Shannon Hadley, when she said, "More than ever, it is important that faith communities and leaders are strong voices for people. This means in a time of COVID-19, recognizing that a call to action on COVID-19 and a call to action on HIV should be complementary and synergistic. They are not in opposition to each other, and we will rely on faith partners to be strong and true voices of support for people living with HIV." Finally, session 3 was closed out by Renata Langley, who is an inspiring young woman who reminded us of the important role of young people in ending the HIV and AIDS epidemic. Renata encouraged us to listen and to really listen to other people's stories, because when we do, it has big impact on how we provide care and support, especially in addressing those social enablers that were mentioned previously. So we give thanks for all of those who participated in session 3, for the stories that were shared, for the data and the information that was resourced, and we thank you all for your attention.